So today I will take about the traumatic brain injury. So traumatic in the CCS, either you will get traumatic brain injury TBI case, and from that case will flow, or in the CBS also you will get a question from the traumatic brain injury when either in the curve or in the carbon loop or in the image table, where you will get in the curve you will get ICP monitoring curve, and where they might ask about the ICP monitoring, and also from there how will you manage traumatic brain injury, ABCD, and also you can get traumatic brain injury CT scan findings, extradural, subdural picture. So let us start with the okay. Yeah. So now the first variant, 28-year-old male on the motorcyclist was not wear the helmet and is brought in the high-speed road traffic accident. GCS E2V2M4 8/15. Blood pressure is 86/54 mmHg. Heart rate 126. SpO2 88 on NRBM. Pupil 5 mm sluggish. Left 3 mm reactive. Airway, blood, vomiters on the oropharynx. First scan negative. Chest X-ray, no pneumothorax. Then the question here, this what is the your immediate resuscitation priority? Describe your airway plan, and which induction agent would you choose and why? And how will you prevent secondary brain injury during intubation? And what are the post-intubation goal for oxygenation, ventilation, and perfusion? So, who want to participate on the discussion? Anyone can come. Priyanka, you are ready today? Nidhi? Anyone of you can John? Chakao?
Yeah,
Yeah.
I can. Let me start.
Yeah. So
Yeah,
John,
so this,
let me tell me about the answer of first question. How would you go for immediate resuscitation priority?
okay, I will apply the ABC
Yes.
resuscitation method this patient, because GCS is already compromised 8/15, and the patient is also hypotensive. So I will ensure the airway is patent, and clear the airway. There's already vomitus and blood in the oropharynx. So open the airway by suctioning and clearing, and then proceed. Breathing is very likely he may have aspirated because of the reduced GCS. So I will proceed to secure to intubate these patients, and then start saline resuscitation for him. Okay, so that would be the priorities as far as resuscitation is concerned.
Okay. So you mean to say that you want to first intubate this patient because the GCS is 4, GCS is 8/15. So your threshold is GCS 9. And also why you will intubate, because the hemodynamically compromised and there is a blood and vomiters in the oropharynx. So there is a chance of aspiration. So that's why you want to intubate and secure the airway, then breathing, then circulation. So in EDIC exam, always you start with A, B, C, D. Okay. So now next question. Next question is and next what will you do? So airway, describe your airway plan. You have rightly described that you want to go for intubation. And next.
Okay.
Next question, which induction agent would you choose and why?
Okay. For in this patient, I can use because of the drop in blood pressure. My plan would be to, of course, to start crystalloid resuscitation immediately to try to bring up the blood pressure. Then I will, of course, the intubation or airway, securing the airway will be by
so ideally
rapid
the
sequence induction.
induction agent should be which does not cause hemodynamically instability further. You can't use propofol in this case. You can't use propofol, but you can use the etomidate, or you can use the fentanyl and the benzodiazepine, which has minimal effect on minimal effect on blood pressure, and also benzodiazepine has some brain protective effect, and it reduces the seizure potential. And how will you prevent secondary brain injury during intubation?
Well, by ensuring that the patient is adequately ventilated, so and is adequately oxygenated. Oxygenation is the one important step to prevent secondary brain injury, and that is the reason why and to oxygenate him, I will need to apply rapid sequence induction.
So secondary brain injury, you have to avoid hypotension, you have to avoid hypoglycemia, you have to avoid hypercarbia. So this three is the main thing, and you have to prevent the seizure. So if there is a high ICP also, and you have to so you in the secondary brain injury, and you have to reduce the ICP. So for reducing ICP, you have to do the good sedation and paralysis. Otherwise, if there is a cough reflex, it will cause your increased ICP. So what are the post-intubation goal? Oxygen and ventilation and perfusion.
Okay. Well, my post-intubation oxygenation goal will be to maintain PaO2 level of at least 75, PCO2 level between 35 to 40, and then ensure that and perfusion target will be to achieve a lactate level of less than 2 by ensuring adequate perfusion, adequate fluid administration.
So perfusion means you have to maintain the perfusion pressure of the brain, and you have to increase the map to maintain the perfusion pressure. Normally the perfusion pressure is around 65, so you have to keep map more than 75.